technologies in healthcare. So we will have the schedule for this workshop as there will be a brief introduction about IHMR Bangalore. We will have a round of introduction to our esteemed panel members. We have some pre-planned questions that we will focus for 25-30 minutes, and then we'll take 4 to 5 questions from the audience. And I would suggest audience and participants to submit their questions in a chat box with the name of panel member that they want to direct the question towards. So to start with, IHMR Bangalore is the branch of IHMR University. Just one second. So IHMR Group itself started somewhere in 1984, and it's basically based in Jaipur. We have branches in Delhi. Bangalore is the South Center, so which focuses on South India, and we have Kolkata Center, which is still a project office. IHMR Bangalore is being operational since past 10 years, and we have been working with various state governments and central governments across various projects. We started our program in Bangalore in 2010s early, and now we are in 10 years. Today we have around 120 students to our postgraduate diploma in management batch, and we have got MBA equivalents and accreditation from NABIT and National Board of Accreditations. So IHMR Bangalore works on the mission of dedicated improvement in standards of healthcare through better management of healthcare and related programs. It seeks to accomplish this through management research, training, consultation, and institutional networking from a national and global perspective. And our vision is to emerge as a world-class postgraduate and research in generating and disseminating knowledge and providing students a unique learning experience in management, education, and in research that will serve the society for its betterment. So we have consistently focused on quality, accountability, trust, transparency, sharing of knowledge and information, and openness. So that's the basic core principles that IHMR Bangalore follows. In terms of academics, our flagship program is 2-year postgraduate management program in hospital management, health IT management, and pharmaceutical management. We have around 120 seats for the same, which are accredited by the NBA. And we have, for this year, we completed our 100% placements for all the 120 students. We also have this training part where we do the trainings for the government offices, private organizations. We engage in certificate programs, which are virtual, hybrid, offline, multiple modes. And there is also a scope of faculty consultancy where faculty consults with different areas. We have been partnered with NABH for quality management, and we are also working in NCD healthcare. We are also partners with UNICEF, and we are also publishing various research articles, reports in peer-reviewed journal. Our flagship PGDM program is AICTE approved. It is an MBA equivalent from Association of Indian Universities. We are among the top ranked hospital management colleges for 2017-18, and we have received the award for national excellence under the Best Academic and Industry Interface from World Education Congress, and we are ranked 11th Best Business School in Bangalore for 2021 by Week, and by Outlook we are 10th. So our programs also come in other ways, like there are short-term certificate programs. We are currently running the programs on CCNH, that is nutrition certificate courses. We also have digital hospital management program, executive programs. It's a 9-month program, and we are also planning to launch many others in the coming time. We are focused in areas of implementation research, health system strengthening, nutritional and health, maternal and child health, urban and tribal health. We are working with ICMR on tribal health. We are also working on behavioral change for COVID with UNICEF. We also work on formative research and impact assessment, social assessment, and large-scale surveys. So that's the key areas where IHMR Bangalore has been working. And currently, we have completed projects with DKT International HL Foundation. We are working with ICMR. IHSC, we just submitted one project, and that's been publishing. The results are being published now. The KEA is one of the key partners in Karnataka, where we work across the government of Karnataka for various evaluation of various schemes with them. And UNICEF has been funding our COVID appropriate behavior project, and this project is also extending for vaccine campaign also. We are accredited across the various sectors like NBA, AICT, and NERF registration is done. We are also empaneled with the national, that is NABED, for recognizing the hospitals or providing certificates and consultancy for NABH accreditation. And we are empaneled with National Health Authority. We have various recruiters on our board, and I think that it just explains the vast area we cover in healthcare, focusing not only on government or private sectors, but a combination of various sectors and combination of various stakeholders. It's a multi-stakeholder atmosphere and ecosystem that IHMR Bangalore is trying to create to advance the healthcare needs in the country. So coming today to our topic, that is Industry 4.0 and healthcare. Before we begin, a brief background is that when we talk about Industry 4.0, it's referred as the Industrial Revolution 4, where the first revolution started with the steam power and where steam became the basis of automation in some areas. Second is where electricity came into play and things became more automated. Third started in 1990s to 2000, where or before that, when computers started to automate the processes. And now it's the area where technology is building more into our lives and focusing on physical, digital, and biological spheres, where technology is integrating every aspects of our lives. So Industry 4.0 is a kind of new thing that will really drive. And the key part here is that for all the first, second, and third industrial revolution, healthcare was the last sector where the technology would reach and bring the changes. But with Industry 4.0, healthcare has become a center of this revolution, and many new emerging trends and emerging technologies are now being first implemented in healthcare. And this creates a need for any medical, dental, nursing, pharmacology, and all the other allied sectors who work in healthcare to understand the basis of technology, upgrade and upskill themselves to suit the demands of changing industry, and that's how they can build a successful career in healthcare in coming era, like in next 2 decades. So we start with introducing our esteemed panel members. So we have Dr. Chandil Kumar. He brings 16 years of great experience on working in various hospitals. In IT sector, he has worked in Narayan Rudalaya, Aster CMC, and Aster CMI Hospital. He's now a co-founder of a technology company called as Health Enablers, and he is working with a mission of focused and unified efforts from all healthcare sector to solve the healthcare issues. And he's also an accomplished health and wellness coach, and we are great to have Dr. Chandil today with us. Then we have Dr. Rumah Bhagava. She is a global public health professional, and she's a Chevening Fellow from University of Oxford. She brings in 14 years of experience of working across advisory and research, government partnership. She has worked with IFRC, United Nations, Government of India. Her expertise are in end-to-end project management, health policy, health system strengthening, and digital health. Currently, she is leading the healthcare domain for the World Economic Forum, and she also is a founder of Samarpan, which is an NGO which provides accessible rural healthcare, education, and livelihoods to children in rural and tribal India. She is an accomplished communicator, presenter, and she is columnist for the Daily Guardian and the Economic Times. We welcome Dr. Rumah. We have Mr. Kumar Satyam. He has been working in the healthcare industry for past 16 years. He has worked with General Electric, Philips in radiology imaging and PSA systems. He has extensively worked in architecture team developing the interoperability solutions for healthcare and deploying the standards for health information exchanges. He also leads the technical committee in India for HL7 and is building on FHR community in India. He was also the part of core group that worked with NDHM, or that developed the National Digital Health Mission. And He has worked with iSpirits, which was the key organization which leveraged the digital technology for healthcare in India. We welcome Dr. Kumar Satyam. We have Dr. Dr Ramesh here. He is a physician with keen interest in technology and application of technology in healthcare industry. He is a founder of a company called MedBlocks, and he started the company with a vision of change to know how healthcare is delivered. He completed his MBBS from Manipal, and he's working exclusively in fields of deep learning, diagnostic and treatment, bioinformatics, DNA analysis, and he has received various national and international awards and recognition. He also runs his own YouTube channel and contributes to GitHub community. So we have very esteemed members. We welcome Dr. Ramesh, Ramesh today. So we will start with our questions for the webinar today. And what we'll have, there are two rounds. First, we'll ask to each panel member a certain questions, and then we will shift to a group questions to certain panel members. And finally, we will take some questions from the audience. So the first question is actually for Dr. Rumah. It's basically, so you are leading the World Economic Forum in healthcare division for India. And the term Industry 4.0 is creating a lot of buzz across manufacturing, service sectors, and healthcare sector. Many of us don't understand exactly when we say Industry 4.0. It's still like a conjunction to industry. They're still confused about this. So can you simplify the concept of Industry 4.0 and how you deem it impacts the healthcare in broader aspects, or how a common person can see that?
Right. First of all, thank you, Dr. Akash and the IIHMR team for giving me the opportunity to the distinguished panel. I think in the beginning and the introduction, you have beautifully explained what Industry 4.0 means, and I'm sure like the students will be researching on the internet. What I will tell is in the layman terms as to what Industry 4.0 means. So the basic concept of Industry 4.0 is that it colludes the boundaries between the physical, the digital world, and the virtual world, and it creates smart, whatever be the products or the processes. And so for the students to understand, so be it like the Siri on your iPhone or the smart watch or the Fitbit appliance, what you're wearing, to the recommendations, what you get on your Insta account, those are all the gift of Industry 4.0 to us. So that's in the very layman terms as to what Industry 4.0 means. Coming on to the next part of your question as to how does it affect the healthcare. So I feel there are two main areas where we will see the shift with respect to Industry 4.0. First, I feel that healthcare will be delivered as a more seamless continuum of care with a clinic-centered point of care model, and which would be more focused on prevention and early detection. That I feel would be the most important tenet of Industry 4.0. And second, I feel that it would be more patient-centric, whereas where the focus will be on each person, that is their own ecosystem, where we can have a personalized treatment plan for each patient. So this is these two will be the most important things, how it will affect the healthcare industry. Also, I feel that since we will have more data which would be churning out, so from different sectors in healthcare system, so we can also see how we can see a convergence of this data. That would be important, and I feel medical research will also experience an incredible advancement due to all this, due to all the new data what we have. So collaboration is going to be the name of the game.
Thank you. I think it clearly explains about the parts where, the personalized healthcare will be the future to go. And it's not only now the doctor who will be the part of healthcare delivery, it will be the other systems, and those systems will work more than required. That was a great explanation. Thank you, Dr. Rumah. Coming to the next question, Dr. Siddharth, we have a question for you. Like, you being an MBBS doctor, and who has also led a technology company and founded itself, focusing on analytics, AI, ML. How do you see the future of medical and paramedical students? Because if you take the perspective of Indian education, we in education also the MBBS students or paramedical students, we don't learn much of technology. So how you see the future of them, and what skills will be necessary for these students to be competitive in upcoming era?
Right. Thank you, Dr. Akash. Thanks for the question. So I think what we do today, right, doctors, what they do today, a patient comes to them, they first talk to them and understand what their symptoms are, what the complaints they come up with. And there is a cyclic process that usually happens, which is they make a decision and then they give more investigations. They perceive that, make a decision, go to the next step. So there is actually a huge disparity between what is possible with just what is available today and what is actually happening. So I'll give you an example. So there was a patient who came with cellulitis, right? So his leg is completely inflamed. We know that it's infection. Patient is in sepsis. He comes to the hospital, and what has to actually happen is the protocol says that you need to start them on 3 antibiotics. Okay, so 3 antibiotics is the standard of care for this particular condition. So people, they start 1 antibiotic, the other 2 antibiotics, they don't start. And the reason is because depending on which unit you admit this patient to, the antibiotic differs. So the HOD of that particular unit is not okay with this antibiotic being given. So what ended up happening was we kept the patient for 24 hours in triage, and the patient just got discharged because he wasn't able to afford the care. So a very simple example, but if 2 antibiotics were given in that 24-hour, the prognosis would have been much better. And this is just a very small example, but what I want to say is we as a medical field, right, what we really do is 2 things. One is perception, which is what is happening in the real world. What is the condition that the patient has? What is the history, examination? So that perception is happening. And simultaneously, we are also making decisions. So with more and more experience, with more and more specialist training, what really happens is that the decision making becomes more and more fine-tuned, and we are able to make better decisions. But I feel that there is a huge scope where these 2 can be decoupled. So I feel there is a scope where the perception is exhaustive, right? You can teach people easily. You can tell, maybe 1 or 2 years, you can teach someone how to really take history, how to really examine a patient. So I see a future where we have, an excellent system, a huge, population of healthcare workers who can get data into the system, and the decision then happens separately. So it may be AI algorithms, it may be with the assistance of doctors, and that gap between perception and decision, that is the gap that's there today. And the main reason is because we don't know the meaning of healthcare data, and that is again where the interpretation problem comes in, which is understanding what this data really means. And that's where I see AI and ML really shining, understanding what this particular data points really means. So yeah, I see the transformation, like for example, self-driving cars. Cameras have been around forever, but the camera to understand that this is a pole and this is a dog, that is the difference in where we are at healthcare. We can push data into a system, but a system is not yet able to understand what it means. So once we break through that barrier, I think there will be a lot of innovations. And to prepare for that, I think people, number one, healthcare providers will need to ramp up their communication skills and understanding what the patient, again, perception is number one here. So communicating properly with the patient and empathizing with them, that will be number one. And the people doing the decision making, right? The people who are designing these decision support systems, they will need to understand healthcare standards. They'll need to understand how to write rules, for example, how to write algorithms, how to look at the data and decide what the best thing to do is. So those kind of skills is what I see happening.
Yeah, I think that's wonderful answer where it's need to be more empathetic to a patient. Like the humanity has to be reserved. What is the human aspect that brings as a medical professional, while other work can be done by AIML. Thanks a lot, Dr. Siddharth, for your answer. The next question is for Dr. Chandil. Sir, you come with about 1.5 decades of experience in healthcare industry. So working in the health industry for 1.5 decade and looking from here to the future, what are your projections on the growth of healthcare IT per se in India? And what will be the skills that are essential for the professionals today to survive in the ever-changing healthcare? And what will be the key opportunities which students will seek? Like, suppose I'm a student of healthcare, what should I look in for myself in the changing healthcare arena in next decade or so?
Thanks, Dr. Akash. Firstly, thank you for having me this evening.
Thank you.
To interact with the students and be a part of the panel. I'm also incidentally part of the academic council at IHMR. My association with IHMR is more than a decade. And I think at IHMR, we have been trying to push the envelopes to make it future-looking and future-ready kind of curriculum. So with regard to your question on what is going to be the IT, for me, IT is an extension of operations. And when we talk of Industry 4.0, it's kind of a revolution what we need to look at. So as you rightly said, there were various words that came up in the last 20 minutes: safety, patient-centric, personalized care. I think these are all the attributes which we need to look at as the future persona of the healthcare delivery. So right now, today, we are at a very disorganized, chaotic environment. At one stage, we have a complete paper-based system wherein there is no mechanism to track what is being even written. Many times we can't even make out, decipher the prescription. At the other end, some institutes have, as Dr. Siddharth said, maybe an AI-based, maybe kind of an OCR-based reading, which can say what is this and what is the complaints and what is the conformity to the treatment protocol. So I think the whole idea of a revolution is to make it as dramatic and pragmatic, to make it as the overarching practice. So my take would be to say that the future has to be, which is tech-enabled, tech inclusive, and largely the majority practice. Right now, what we see today is in isolated pockets of innovation or compliance or technology being there. I think we should edge and aim towards making it largely technology involved and data portability. What we call as interoperability should be the key thing. Right now, what happens at PHC stays at PHC. There is no movement of patient data that happens. There's no confidentiality. There is no security to the data. See, I think these are the attributes we need to bring in. So that, I think, is what Industry 4.0 for healthcare should mean. Definitely, AI, ML can play a role of data mining, data assimilation, meaningful data interpretation, decision making based on that. This becomes the extension of what I said. In terms of skill set required by students, I think they need to first understand the workflows. Right now, today, we have very little understanding of the bricks of healthcare system. And not to say the least, I think we have so many systems, and India is a country of many systems. We have allopathy, we have homeopathy, you have Unani, you have you name it, you have it. So how do we kind of build a comparative block so that it makes a meaningful system? And once we have that, I think it's easy for students to pick on one area and try to build it across. Data sanctity is definitely one skill set which everybody needs to know. And then how do you get insights into this data, and how do you build a predictability based on this? So I think a lot can be spoken on those lines, but the whole idea is it should change two things according to me. What impact does it make on a patient? Healthcare should become really like it kind of a reflexive action for people to seek. It should change the health seeking behavior of the patients, and the complaint should go up, and definitely the cost should be contained in the whole process. I think that's a huge challenge for us, and I think the myriad of skill set that is required to put each one in its place. So I would definitely say that the operations research, operations understanding of the healthcare system should be the focal point for people to build on the IT skills. I don't know if I've complicated it, but that's my take.
No, it's good, sir, because it's still as in India and healthcare industry is still in a nascent. We are growing very rapidly. I mean, the growth is rapid. There is a kind of silos that are built, and there is a kind of too many clutter. So it will take the industry time to mature, and as it matures, people will also be able to generate new ideas and make more solidified. So thank you for the answer, sir. So next, we have a question for Dr. Kumar. So you have contributed to the National Digital Health Blueprint, and which is a pioneering document in directing the digital transformation in India. Like the funds are now coming for digital health in India, and the investment from government, the policy push has actually accelerated few things, specifically teleconsultation and other areas. So can you explain how NDHM will increase the demand for healthcare professionals who are trained in digital health, and what skills the student should have to work in the changing policy environment that NDHM is bringing in India?
Yeah, thank you, Dr. Akash. And I'll just build up on what the panel members have said earlier. And it's not specific just to NDHM. The scope of opportunities that are there in healthcare per se, and digital health and healthcare IT is immense. And I say because you have seen like how Dr. Rumah, Dr. Siddharth, and Dr. Chandel have brought in both the opportunities and the challenges, right?
Yes.
And these have a lot of scopes. Right? Opportunities are not realized, so we have to work towards it. Their skill sets will be required to meet those opportunities. Also, there will be skill sets and need for people to actually overcome the challenges that Dr. Chandel mentioned, right? So that's how I see the opportunities that lie ahead for us in terms of healthcare IT in India. So now coming back to focused NDHM, National Digital Health Mission, now it is called ABDM, Ayushman Bharat Digital Mission. And today I was just going through Twitter feed, and I got to see like the cabinet just approved 1,600 crore budget for ABDM to be spent for implementation in next 5 years or something like that, right? So that means the government is like the intent is there, and there is also funds, means there is implementation focus, right? So now, as Dr. Chandel mentioned and Siddharth mentioned, like the data capture or the way we do healthcare today is very different, right? So it's like siloed, it's paper-based, it's more on whims and fancies, right? And what ABDM, if you see, is trying to bring is a degree of standardization, a degree of protocols, as Dr. Siddharth said, like, so a standardization in what it means, right? So when you say a patient record has been received, what exactly does it mean? What is a clinical summary, right? Those kind of things that are going to come. So what I see is like when we are moving from a disjointed, chaotic, paper-based system to a more seamless, interoperable, standard-based system, which ABDM is trying to push, right? The requirement for health care professionals, I'll not say healthcare professionals, I'll say like professionals who are working in digital health. They could be doctors, they could be engineers, they could be biotech engineers, paramedic, anyone, right? Is immense. And what I'll say, like, for example, I'll just take 1 or 2 or 3 skill sets and just say, like, for engineers, right? So engineers to make sure that the systems are ready for the next ABDM push, right? So all the HIS, all the EMR systems are ABDM compliant. That will be a requirement of a huge manpower, right? Standardizing the data that is there, right, will be a big push. Secondly, like if you are saying like the management staff or the management people, right, just making that change management within the hospital and just managing that transition, right, is going to be a big deal of work. And there will be a lot of demand for engineers and management professionals and other allied skill sets, right? Even for doctors and all, I think there will be a transition, there will be a shift, like so from paper to actually to digital world. And there I see need for new upcoming courses, upcoming ways, paradigms, softwares where the doctors can easily move to digital, right? So what I see is a lot of scope for engineers, management guys, and even for clinicians who are ready to get onto the tech, right? So I think slowly it will be like tech will not be an option. Today, if you see in hospitals and in Indian hospitals, I'm talking about, IT is optional, right? IT is a necessary evil, right? Means it's like because you have a digital pathology or because you have an X-ray machine, you need a computer, right? Because you have to do billing, you need a computer. It's like that in today's healthcare in India, right? That is going to change. That is going to flip. IT will be the center point. It will be the main focal point of hospital of industry 4.0, right?
Correct.
And when that happens, then the skill set that is required will be from engineers, from management, from all the guys who are getting into like who are going into training courses. A lot of YouTubers, as Siddharth is doing, and Siddharth is doing a fantastic work of actually creating course and curriculum for people to know how to move. So I see each and every stream getting benefited, and each and every stream explode, means the career opportunities exploding. And that's what I take, means the ABDM is going to just create an explosion in opportunities for professionals who are working in digital health in whatever capacity they are working in. That's how I'll put it.
That was a great answer, Dr. Kumar. And what I also feel is that government is the major player in healthcare. Like the poorest of poor sections of society do benefit from the government services. So the push and the money policy changes are really welcome, and it will hopefully create a large chance or large scope for the students who are coming in healthcare and also the IT multi-sector students to work in and enhance the healthcare delivery in this country. So we'll move to round 2, which is more specific, focus to short questions that that students will want to answer when they are looking at the career. So we have first question for again Dr. Rumah. So you have been working with the World Economic Forum and you're working with various stakeholders. So what is your stake on the competencies and readiness of the current healthcare workforce in terms of Industry 4.0? Do you think that they would be able, with the knowledge they have or the skills they have, to adapt to the changing environment, or they will require certain time and that will delay the implementation of this technology?
Right. So, Dr. Akash, like if we talk about the health workforce, I feel there would be like, we can divide it into two ones. One who will be making these products, or I would say the technology which uses 4.0, and the second would be the users of these technologies.
Correct.
So, and at this point, if like I would say for both, I would like to echo what Dr. Chandil had said, that they should be having an in-depth knowledge of the health systems in India, because also in India, since like health is a state subject, so we have a different health setup in every state, though like the broader architecture remains the same. So that is like one, if we want to devise any intervention with a public health perspective. Also to keep in mind that the solution what they are devising from, if I take the workforce from the one who are devising the solutions, so that should be keeping in mind the Indian health landscape. It should be affordable, scalable, and the quality, like those are the basic parameters what we see missing in the present healthcare system, and which could be which can be used to bridge the healthcare divide. So that is like something what I would say that those would be needed. And training, of course, like at the level of various stakeholders, be it the government sector or the private sector, they need to upskill their workforce at every level. And of course, the training should be how it should be in accordance with the level of the healthcare workforce, who and which is using the technology. So we cannot be having the same training for each and every part of the stakeholder. And of course, like understanding of that particular solution is important. If anyone is devising a particular solution for a particular ailment, then we cannot be just closing eyes to the medical aspect of that and just bring in technology. So being a clinician myself, and of course, like the co-panelist would agree that technology cannot be seen in isolation alone. It is complementary in intervention what we put. And so technology can never supersede as to what a particular medical practitioner brings in. They can always complement and amplify the impact what we have.
Correct. That's to the point, because technology cannot substitute for medical practitioners, so we cannot remove them from the equation, but they need to somehow be friendly or befriend the technology that is actually turning their life and actually running their bread and butter. Thank you, Dr. Rumah. The next question for Dr. Siddharth, and this is like specifically with your medical background and your coding skills that you have learned. So what do you feel like this core medical branches, medical, dental, health, Ayush, nursing and all, how should they enhance, or how should they nurture the entrepreneurship skills to build a successful career in this IT health arena? Because this is where we are looking for funds that are flowing in from government. There are private entities. So how can these students, or how can they, if they want to be entrepreneur, what should they really have 3 or 4 key things that they should work on?
Right. So yeah, again, that's a good question. By being an entrepreneur, I just want to clarify that it need not be a startup. So firstly, it will be more time than if you are working in a normal job, and you will be spending more time. But the payoff, if you think about it, you have the independence to do what you want. And there are a lot of businesses, again, not startups. You need not come up with something completely new. You can something like consulting. You can consult in your own time. Something like solving mundane problems that the hospital is having every day. For example, now ABDM is going to be coming out as a, once they start mandating claims, which I think they will be, it will be a huge demand, right? Everybody will want their system to be compliant. So having some sort of skill set to understand the hospital workflow and to understand how you can provide your skills through a consulting basis or through a product, that is what's actually needed. Now, regarding can entrepreneurship be taught, I'm not sure. I don't know. But I think there is a huge potential for normal businesses. Like you need not, so this is where most people confuse between entrepreneur needs to do something new, and they'll just be like, this thing already exists. If it exists, then it's good because people are already making money out of it. So, go do something that already exists. You'll probably be making, and if you do it better than the competition, you have the potential to make a lot more money than if you're employed under someone. So something that people need to know, and especially there is a lot of demand for consulting when it comes to interoperability solutions. A lot of international demand is there. India also is picking up with ABDM right now. So there is a huge market out there. I think if you learn your skills, right, if you have just the basic skill set and learn the problem in more detail, you can do really well.
Thank you, Dr. Siddharth. I think with the intrapreneurship or becoming an entrepreneur is a new fad that India is witnessing with the money is flowing in, the markets are flourishing. So many of us plan or at least dream of becoming. So this is a good, a kind of eye opener for the students to understand it's not an easy part, but if they take it and do it well, then the rewards are much high in that area. Next, we have a combined question for Dr. Chandil and Mr. Kumar. So looking at your journey so far from in a healthcare industry where you have worked since the very beginning when IT was a nascent stage in India, and now it is becoming a mainstream subject. What are the key 2 pitfalls that you feel students should avoid if they want to succeed in this healthcare industry? Because you have a lot of experience, you have seen many people fall and you have seen many people rise also after the fall. So how you think, what are the caution that you will raise for any student who is planning to work in this area, or who is planning to start his career or her career in this area?
Yeah, so I think that's a very good, valid point. I've been talking about this for a long time, especially in healthcare. To look at IT in isolation is the biggest pitfall. It is not another department. It is an enabler. It is a weaving pattern for binding all the other elements. That's how the efficiency comes in. So IT is definitely not just one more department. And I quote this example to say most of the IT departments in hospitals are in basement next to the store or in exit and entry of the parking lots. I think that is something we'll need to look at it as an overarching factor which brings in a binding force across all other operations in the hospital. This is one. And the second pitfall is to not look at it from a journalist view. Just to look at it, just saying that I know IT because I understand how IT works, but I think you need to have a core skill set which is more technical in nature, maybe to understand how the coding happens or how, let's say, interoperability works. I think we spoke about interoperability, and Satyam and me have been working in HL7 for the last 15 years, and I think that's a key one. Just as an example, that's a key element to understand how interoperability works, or how packs get connected to HIS, or how does the images move in a COM-DICOM environment. I think there must be some core technological strong areas for somebody to understand how does it work. In my opinion, those are the two things. I'm sure Kumar, Satyam will have more to add to it.
Yeah, thanks, Dr. Chandil. I'll just build on that. So one of the pitfalls that needs to be watched out for is getting boxed into your roles, or getting boxed into, I am a management guy, I will not do coding, or I'm a engineer, I would not look at management, right? So, or I just do coding, so I don't know how to speak, and I don't want to get in front of camera and speak, or record blogs, or do whatever, right? Mm-hmm. So this is one of the most important pitfalls for students, right? So it is like, you don't box yourself, right? So though you are pursuing engineering, it doesn't mean that you don't need to know how a hospital runs, or how to create a presentation, right? So, and similarly, if you're a management guy, don't say that you will not deal with technology. You will deal with technology. Don't say that, okay, technology I don't understand, because that's the mindset today, right? Industry 4.0, you have to be a little bit of everything. I mean, so you will be expert at certain things, but you need to, there is no escaping technology, and there is no escaping an all-rounded impact, right? So you have to know a little bit of one thing. So don't box yourself. That's the first thing. The second thing that I'll say is the pitfall that I see is I have seen that, right? So that's another pitfall, right? Mm-hmm. I have experienced that, I have seen that, and I know how the thing works, right? The rate at which the changes are happening, the new technologies are coming, and how the older models are getting obsolete, or how they are getting made redundant, right? The other pitfall is, don't rely on your experience, just on your experience. What I mean to say is, just because you have worked in a certain stream, or you have excelled in a certain stream for, say, last X number of years, does not guarantee your future, right? As in stock markets, they say, right, that past performance is not a guarantee of future returns, or something similar, right? So same thing is true for careers, right? So always stay hungry, stay foolish is another thing that comes into mind, right? But the thing is, the first point is, don't box yourself. And the second thing is, don't rely on what you know. Just try to always learn, unlearn new things, because the rate at which the disruption is coming, you have to be always on the toes. And these are the two pitfalls that I think students should guard themselves for.
Great. Thank you, Dr. Kumar, for your valuable answer. So we are coming to the end of the panel questions that we had planned. The only question is I would like to ask from all of you is that if we start today at 2022, maybe next 5 years, what is the key message that you want to give to the students that are attending this webinar? Like, what is the one key takeaway that they should take away from your perspective for the next 5 years? it's a combined question, so you guys can.
So your question is like, what is the key takeaway for the students 5 years down the line?
Yeah, like if they are planning to start a healthcare IT or even any profession in healthcare, what is the one thing that they should focus on, or what is? I think you already answered that. We think, oh, we stay hungry, stay foolish, but more of thing that they should feel that, okay, this is the one key takeaway they learned, maybe from Industry 4.0 or entrepreneurship or anything like.
Okay, from my side, Dr. Prakash, it's a double-sided sword, what I would call as digital twinning. That's a reality. We all live two lives. At the same time, how do we really live the life in the real world? So I think understanding the nuances of the skill of managing both is a key skill which is required.
Great.
Yeah, and I'll say, like, while it looks all fun, it's actually a very hard work, and it's fulfilling as well. So what I mean to say is, folks who are taking in healthcare IT, it's first of all, you should think of it, it's a life-changing thing. So whatever work you are doing is going to impact lives of the people. Your code, your software, your project management, your contribution is going to impact care, and impacting care can lead into saving multiple lives or many lives. So first of all is keep that in mind, right? So 5 years down the line, whatever you have done is going to actually impact somebody's life. So keep always that perspective in mind. It's not just any career. It's not healthcare IT or healthcare is not just any career. It's a career, plus it's a big responsibility and big impact. Whatever you do has an impact, direct or indirect. So keep that in mind.
Yeah, thank you. So we, yeah, sorry, Toma, you were saying something.
No, I just wanted to like make a last point for the students who are like thinking to make healthcare as career, be it like public health or in the private healthcare space, taking IT or not. They should visit the field. Field visit is very important. You should be spending time. If you are taking a public health, or maybe IT or designing any solution, without like thinking of IT, you should be spending time with the clinicians and the end users of their technology, of that particular technology. That will help you not only in understanding the problem better, but also in devising the solution.
Thank you.
Yeah, just adding to that, I think,
yeah,
especially when you are directly dealing with doctors, so they will not be happy with anything that you provide most of the time. So, I think growing a thick skin to that and showing up every day and asking, what do you need? How do you want it? And it's mostly about being sincere and just showing up. So yeah, doctors will be mean to you. I don't know how that happens, but there is something there. So just grow thick skin to that, and get over that, and things will come soon. But yeah, I don't know what to say about it. Yeah,
I think it's really relatable to what you said. We have all faced the same things, that there is a kind of how to say it better, but there is a resistance from medical fraternity itself when it comes to technology, and there is no reason that we don't know what leads to it.
It's a specific technology. It's a healthcare IT is what the reluctance to, but I think technology wise doctors are good, right? Correct. It's only healthcare IT that they are more like aberrant to, right? So we have to work on
I think
IT.
I think it's resistance.
Otherwise
to
they are
change.
good at all the other things, right? They like that doctors talk AI, ML, and radiotherapy and all, right? But when it comes to entering data into computers, I think that's where there is a problem.
But also, let's be cognizant. I think things are changing. I mean, 12 years back when I used to train doctors how to use systems, to now, I think it's also a generational thing, right? I mean, the old timers are now being replaced by new timers who grew up with computers.
That is correct. So we have several questions from the audience. We'll take 2 to 3 questions. We have one question for Dr. Chandil from our participant called Janaka. He's based in Sri Lanka, and his question is that what should a student, a university graduate choose? Should he first enter the field of healthcare and IT or something, and then and then specifically focus on learning a skill which is beneficial to him, or should he first learn some skills and then enter the industry?
Yeah, thanks for the question, Janka. Janka has been very active in healthcare IT. He's the voice which we hear from Sri Lanka. He's trying to do a lot of things in healthcare IT in Sri Lanka. See, from my perspective, would be to even start at the high school level to have multi sciences, converge into one. I think the future is going to be translational research, translational medicine, translational engineering. So, end of the day, today you cannot have one field of science in isolation. A lot of things need to converge. So, the sooner the better, the earlier the better. I would advise even a foundation course which will have multiple streams. Then, as you go on, you converge. Maybe over a period of 3-4 years, you converge on to choose what you think is more meaningful.
Great. I hope it answers your question, Dr. Janaka. There is next question for Mr. Kumar Satyam, and it's a kind of what I also thought. Like, if the Modi government changes in 2024, will the fund for NDHM also dry up, and will it also be another failed project for India?
I seriously don't know about it, but I think at a policy level, and what I see is like governments are continuous, means the policies are continuous. So I don't see that happening. I don't see that happening because countries are run by policies and frameworks, and I don't think those change much because of government changes. But yeah, I don't have a exact answer. Yeah, that's my answer.
Thank you, Doctor. We have one question for Dr. Siddharth, and the student wants to know, does this mean that the healthcare students also need to learn coding? I think he means from the core branches needs to learn coding to survive in healthcare industry.
No, not at all. There is a lot of work that needs to be done in the intermediary stage, where you need to have domain expertise, but you don't necessarily need to learn how to code. And learning these tools and technologies, like, for example, in open air, designing archetypes and designing templates and understanding the clinical workflow and knowing enough to give that to the next team. So that is important. Knowing how to talk to them, knowing how to interface and push that idea is important. And knowing how to code, again, coding is just another tool, right? If you think about it like that, it's I wouldn't say you need to learn it in order to stay competitive, but if it's something you enjoy and it will give you a technical advantage, you will be able to do things that other people in your field are not able to do. So, but it's not like it's optional.
If I may add just to what Dr. Siddharth said, and just building on what he said about the domain expertise, we face an acute shortage of domain experts and product managers in the healthcare IT world, right? So if you are a medical professional and you are getting into healthcare IT, I think that's another area that is actually needs very good guys, right? Who are like domain experts who can actually build, give requirements for the engineering teams, right? And be the interface between the medical world, the doctors, and the engineering team, right? So that's, and for that, you have to be good at what you are, right? Means you have to be good at the medical profession that you are, understand the healthcare domain, right? And good at translating that into requirements, right? So, and that's a big gap that we see, lack of quality product managers.
Yeah, thank you, Dr. Siddharth. Thank you, Mr. Kumar. We have a last question for the session that is actually related to Dr. Rumah. And it's kind of complicated, but what he wants to say is that today the healthcare is delivered the same way it was delivered past 2 decades in India. We have small clinics and people prefer to go there. How you see that the industry 4.0 or the IT will change the way and will do this in next 10 years, or is it again a long process that you envisage here?
So healthcare service delivery, it has changed. I would say it wouldn't be wise to say that it hasn't changed. In fact, like, we have the panelists over here who are contributing to how the healthcare system has changed in the past few decades. How I would say that in terms of India, if I see how it can be, how I see is that point of care testing and point of care devices, those are like the two key areas where I see healthcare revolutionizing, both for the patients as well as for the people sitting at the policy.
Yeah, I think it's kind of difficult to predict the nature of industry, but surely things are changing post-COVID. So hopefully these things will accelerate and we will benefit. We have no more questions from audience. I think we have covered most of them, and we are on time. So I would really like to thank all the panel members for their support throughout, and they have dedicated the time to join in this activity and also sharing their valuable thoughts. And I would also like to thank the IT team at IHMR who work tirelessly to ensure this webinar runs smoothly. I would also like to thank Dr. Mr. Pradeep Kumar, who is a health IT, and he has managed and backend everything. Dr. Kriti and Dr. Deepa, who also supported, and the digital marketing team at IHMR, who ensured we have a good participation number. And also to all the participants who joined today in a weird time of 5:30 p.m. Saturday, and made this a successful event. I would like to thank you, everyone, and good evening. And we have a feedback form to the participants in chat box. You can fill it and do let us know if you want to improve or what you want to see in next webinar series. And I also thank all the panel members once again.
Thank you.
Thank you.
Thank you so much.
So I think I'll just answer some of the questions in the chat. I think by Jyoti Arora. So yeah, 16 years of experience in IT and how you can utilize Ayushman Bharat digital mission. Okay. So ABDM especially is made up of these FIRE profiles. If you go to the NRCS website, you will know them. So learning how to translate between one another would be something that you as a domain expert will know better. So I think that's one area that you can definitely help in. So I'm just seeing another question also. I think others can drop out since I'm just yeah, one more is there, I think by Pranav. It's a combination question. Can a paramedical staff who doesn't have knowledge of C programming languages, do you think it will be made obsolete in the... So I think, again, programming languages are just tools. So whether you use C or C++, it doesn't really matter. At the end of the day, learn something and use it whichever is right for that particular domain, right? In health IT, most of the things are written in Java and .NET if you come in. But again, C and C++ are not becoming obsolete anytime soon. They are mostly the most efficient, as they say. But yeah, that's so again, thanks. Any other questions?